Greetings, I'm Dr. Carl Nath, Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to share with you our editorial entitled Mayo Clinic Proceedings, Commemorating a Century of Continuous Communication, which appears in the January 2025 issue of Mayo Clinic Proceedings. This January issue of Mayo Clinic Proceedings is the first in volume 100 of a medical journal that has been continuously published since April 21, 1926. That date marks the provenance of Mayo Clinic Proceedings, which was then titled The Bulletin of the Mayo Clinic and the Mayo Foundation. To build up to recognize, and to commemorate the centenary of publication of Mayo Clinic Proceedings that will occur in 2026, we plan the monthly publication of editorials, beginning with this issue and continued all the way through to April 2026. These editorials will highlight notable contributions published in Mayo Clinic Proceedings during the course of its venerable existence. Medical journals have diverse roles, many of which continue to evolve, especially in this age of digitalization, the internet, open access, artificial intelligence, preprint servers, and social media. The rationale for and the functional significance of most, if not all of these roles, however, still coalesce around the communication and/or the discussion of medical knowledge. It was with this intention in mind that the Bulletin of the Mayo Clinic and the Mayo Foundation was first introduced in 1926. To provide a forum for communicating and discussing medical knowledge, in this case institutionally and specifically by and among the medical staff of Mayo Clinic. As the content of this Mayo Clinic-supported publication evolved, the Bulletin underwent several name changes with the adoption of the name Mayo Clinic Proceedings in 1964. The first editor-in-chief and editorial board of Mayo Clinic Proceedings were appointed in 1964. External peer review was initiated in the 1970s. External editorialists were invited in the 1980s. Submissions were open to non-Mayo Clinic authors in 1992. In 1996, Mayo Clinic Proceedings refreshed its purview and focus from a multidiscipline journal to a general and internal medicine journal. And in the same year, Mayo Clinic Proceedings engaged its first publisher. By 1999, Mayo Clinic Proceedings controlled circulation reached 120,000, and it was this controlled circulation in large part that enabled so many international physicians, including myself, and international institutions to become acquainted with and value the proceedings. With such expansion and accomplishments, Mayo Clinic Proceedings thus established itself as a prominent general medical journal with a national and international intent, reach, and readership. During these years, Mayo Clinic was on its own trajectory in becoming the largest integrated, not-for-profit, multidiscipline medical practice worldwide, with the most number of number one rankings, as well as its own trajectory in supporting the largest postgraduate medical education program worldwide. The evolution of Mayo Clinic Proceedings and its forebears, from their provincial beginnings to an international medical journal, thus proceeded alongside the growth of Mayo Clinic itself. Such growth and success of Mayo Clinic Proceedings reflect the leadership and the multitudinous and unique contributions of its prior editors-in-chief, Dr. Edwin Baird, Alvin Hales, John Juergens, Robert Seekert, Pasquale Palumbo, Udaya Prakash, and William Lanier. The current editorial team was privileged to assume the leadership of Mayo Clinic Proceedings from Dr. Lanier and his team. Dr. Lanier innovatively and brilliantly led the expansion of the proceedings in becoming a successful journal with a global compass and reach. Under Dr. Lanier's leadership, Elsevier was successfully engaged in 2012 as the publisher of Mayo Clinic Proceedings, and engagement and collaboration that continue to markedly promote the success and growth of the journal. The appeal of Mayo Clinic Proceedings has long resided in its diversity of content that is intended to reach a broad readership. Academic as well as practicing physicians and other providers, generalists as well as specialists, internists as well as surgeons and interventionalists, educators as well as trainees, regional as well as national healthcare students and savants. Such content has historically included, among other types of articles, editorials, commentaries, original articles, reviews, special articles, residence clinics, letters to the editor, medical images, and path to patient quiz presentations. The current leadership team added new sections that include women's health, the medicine of sex differences, aging and geriatrics, meta-analyses and new methodologies, physician and healthcare professional engagement and fulfillment, diversity, equity and inclusion, community engagement, medical ethics, and a team of international associate editors. New types of articles include perspectives and controversies, research letters, innovations in medicine and surgery, thematic reviews, and understanding disease, the latter providing an in-depth exposition of the pathogenesis of disease and or their treatment, written by an expert but geared for the generalist. At the beginning of the table of contents in every issue, and started in May 2019, there is now In the Limelight article that provides synopses of approximately 400 words of 3 articles that are not currently highlighted by an editorial in that issue. This feature is intended to attract the attention of the reader to these articles, and by drawing readers into the journal to engage their perusal of other journal content. With the expertise and support of Elsevier, our website has been entirely refreshed with expanded content and newsworthy items, and displayed in a more arresting, easy-to-navigate fashion and format. Our website is www.mayoclinicproceedings.org. To provide a sense of the type of literature published in the proceedings, the following original articles were published over the past year or so. Dietary sodium intake as a risk factor for type 2 diabetes, cognitive decline as a risk factor for chronic kidney disease, a study which was based on the UK Biobank data and Mendelian randomization, the adverse effects of proton pump inhibitors on bone health in patients with rheumatic disease, the presence of decreased white matter in the brain in older adults using prescription opioids, chronic lymphedema as a risk for non-melanoma skin cancer, a clinical trial demonstrating the beneficial effects of social behavioral intervention on metabolic risk factors in resource-limited communities, calf muscle pump dysfunction and all-cause mortality, and the efficacy of inclisiran in reducing LDL cholesterol. Articles that emphasize innovation in medicine and surgery include the use of machine learning in the diagnosis of pulmonary hypertension by echocardiography, the use of human acellular vessels for arterial bypass in chronic limb-threatening ischemia, and exosome therapy as a novel strategy to promote the healing of chronic non-healing wounds. Reviews are regularly published as, for example, present and evolving therapies for migraine, pathophysiology and classification of obesity, the management of vasomotor symptoms of menopause, the diagnosis and management of myalgic encephalomyelitis chronic fatigue syndrome, and the management of C. difficile infection. We promote the publication of clinical practice guidelines such as the management of type 2 diabetes mellitus based on the Department of Veterans Affairs and Department of Defense clinical practice guidelines, the Princeton 4 consensus recommendations for the management of erectile dysfunction and cardiovascular disease, and the diagnosis and evaluation of osteoporotic fractures based on the International Working Group on DEXA best practices. Our perspectives and commentaries include such discussions as the controversial role of large language models in medical manuscript writing, the pros and cons of traditional Medicare or Medicare Advantage from a leukemia and cancer perspective, the recent increase in maternal mortality in the United States, the current challenges and hurdles in the career of the clinical investigator, measuring and monitoring health equity in healthcare organizations, hypertension care in the digital age, and the pressing issue of medical supply shortages. A recent Understanding Disease article discussed oxalate metabolism and its involvement in kidney and cardiovascular diseases. Mayo Clinic Proceedings jointly published with Kidney International the Mayo Clinic Consensus Report on Membranous Nephropathy. Over the past year, we have also published a thematic review series on forward thinking on clinical trials and clinical practice, and another series on physician health. The success and stature of Mayo Clinic Proceedings are underscored by the following metrics and accomplishments. In 2023, the journal received submissions from some 60 countries. The majority of articles published are from authors outside Mayo Clinic. The number of its downloads in 2024 is expected to exceed 7 million, which is the highest for the journal. Its current impact factor issued by Clarivate is 7.2, placing it at 23 out of 239 general medical journals. The 2023 site score is 16.8, placing the Proceedings 21st out of 636 general medical journals. Its time to first decision is 13 days and to acceptance is 83 days. And the diversity and depth of submissions to Mayo Clinic Proceedings enable the publication of 2 expansion journals, Mayo Clinic Proceedings, Innovations, Quality and Outcomes in 2017, currently led by Dr. Timur Shea, and Mayo Clinic Proceedings, Digital Health in 2023, currently led by Dr. Francisco Lopez Jimenez. We are delighted to introduce in this January issue the inaugural and foundational contribution to the series of editorials commemorating this century of publications. Dr. Gianrico Ferrugia, President and CEO of Mayo Clinic, highlights the growth, success, and some of the seminal contributions of the Proceedings, and underscores why journals such as Mayo Clinic Proceedings and its expansion journals are critical bellwethers and forums in uncovering and discussing the challenges, opportunities, and innovation in the current landscape of healthcare. This will be followed next month by an editorial by Drs. Fonseca and Maya focused on salient contributions in medical education published in the Proceedings. Finally, we thank all the authors, reviewers, readers, and other contributors who have enabled the raison d'etre and longevity of Mayo Clinic Proceedings, and who have made this century-long journey ever so fruitful, fulfilling, and indeed feasible. We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.